On Friday, the health officers wrote a letter, was submitted to the governor's office over the weekend asking for indoor mask mandate across the state. Some counties have already done this. So we've got Thurston County has already done it, and so has Kitsap County, King County. I expect to see the governor come out with a mandatory indoor mask mandate today, tomorrow at the latest, probably. We did go through the vaccine mandate does not apply to any of our county folks, so got that clarified. We've been very busy. I talked to our folks downstairs a little bit ago. Over the weekend, we've had a minimum of 39, and we're still counting. So it is on a steep increase, and we are having more hospitalizations than we've ever had. So I think today we're at 8. But we had 9 and 1 out, and then 2 out, and then 2 came in. So it's staying busy. What we're having a problem with is lack of staffed beds, not necessarily lack of beds total. It's a staffing issue across all the hospital system. So we're watching it. My staff is coming back from vacation. So when the rates all went down in July, we started getting people out on vacation, and now we're starting to get them back so we can be fully staffed again.
In Kitsap County, the Bremerton urgent care and all that had been closed down. It was supposed to be temporary because of staffing. And then sadly, now the Silverdale, which they have just built it and everything, that's had to slow down because of staffing, even though they're using the staffing from Bremerton now. And they're still falling so far behind that the lines are going out the door and ambulances are waiting in the parking lot. It is a very scary time. You know, matter of fact, take the time to thank Kevin Schuette's wife when you get a chance, folks, because right now she's doing stuff that we're just begging others would stand up to do. So please extend our appreciation to her, Commissioner.
I will. Thank you. I appreciate that. So it kind of begs a couple of questions, Dave. So, how does this compare to where we were, at the peak in the fall? Is it about the same? Is it worse? I can't imagine it being better. Yeah.
Yeah, it's worse.
So
Delta seems to have a steeper climb. And then in my research, I'm seeing that it also has a steep drop and it doesn't have a lot of hang time. So it was a big discussion on Friday amongst the health officers, a wide variety of opinions on it.
So, from a county perspective, are we thinking about going back to releasing data more regularly? Are we thinking about increasing EOC meetings? What are some things that we should be thinking about in order to reinforce, the public health response? Right.
So we're going back to more frequent EOC meetings. We're talking about a Monday, Thursday with the EOC, especially around the PIO piece that we need to get that information out. We had scaled back the daily stuff because we're only 1 or 2 cases a day. Now it's back up, and now that my staff's coming back, I think we can probably go back to a daily release on that.
I'd like to see you do what some of the other counties are doing, which is not just, they're showing it in the form of a graph that is showing little people, for example, how many new we have this week, how many of them were vaccinated. Because there's a lot of misinformation right now that's out there with the huge percentage people are talking about that were vaccinated that are being hit with COVID again. There's some new information just came out, was it yesterday or Saturday? That was a little bit surprising when it came to how the shots are working. We already knew that Johnson & Johnson for the Delta was only 60% to start with, 72 for the regular one, I think it was. Then you had Moderna and Pfizer that were up in the upper 90s there, but Moderna Pfizer after 6 months is down into the 60s. Moderna is still holding up into the 90s. So just having that information will help people decide what they're going to do.
Yeah, that's really a nuanced thing too, because you have to remember those early testings were done when things were different. First of all, Delta wasn't out there, and a lot of people who were in the test categories were people who kind of are pro-vax, and we're already doing the proper things. They're already social distancing and masking. And then when you go to the population at large, where you have a much broader variety of folks, then those efficacies tend to come down. But I think the bottom line for people to know is that the vaccines are doing a good job of keeping people from getting extremely sick and staying out of the hospital. You know, when you look at our graph, and I'll certainly put that out today. I've got a graph showing rate of hospitalizations for unvaccinated community as a whole, and then vaccinated. I mean, it's just really a tiny amount at the bottom. So I can put that out today.
Yeah, I think that's what we need the public just to see that, so they can make their own mind up. As you already know, and everybody here knows, I am not for forcing anybody to do anything, but I am for getting them the education, letting them make their own decision, and then empowering them to do whatever they decide they want to do for or against.
Yep, will do.